Namaste. Good morning, honorable ministers, senior officials from the Government of India and Rajasthan, distinguished guests, ladies and gentlemen. Of course, Rajasthan is a beautiful city on everybody's to-visit list, certainly on mine. The state is well known for its royal palaces, for its history, for its bravery, for its culture, for its hospitality, for its desert landscapes, and of course for the great food. And I too am happy to be able to experience that here in Jaipur today. Of course, what brings us here today is to mark, witness, and learn from the state's commitment to providing equitable access to healthcare quality to all. The proactive steps taken by the government of Rajasthan to improve health outcomes are well known, and I want to thank the state government for inviting me to speak for a few minutes about USAID's role in helping to advance this initiative. I often, before I go to a place, I ask my colleagues to think of a proverb or a couplet that would be useful. There's a couple of them here. One I do want to say at this point is, some of you may have heard of it, Avashyatka, Avishkar ki janana hai. I think it really is true that necessity is the mother of invention, and given all the necessities that this world faces, it's particularly true in the area of health. The challenges are enormous, and I think it's always worth reminding ourselves that it's not just about the numbers, it's about the real people that lie behind those numbers. Several thousand pregnant women and children below 5 years of age die each year due to pregnancy-related complications, malnutrition, pneumonia, and diarrhea. The majority of these deaths are preventable. In fact, there's an estimated 2.2 million tuberculosis cases per year in India, of which only 1.5 million are said to be diagnosed and reported to the government. There's also estimated to be as many as 700,000 undiagnosed cases of HIV/AIDS. Without proper diagnosis and care, people are unknowingly spread infections to those that are closest to them. In addition to these challenges, the increased cost of health care prevents a real barrier to some for accessing that care. In fact, in an attempt to reach out and access healthcare services, millions of Indians are pushed into poverty every year. This, by the way, is a phenomenon around the world, that one of the quickest routes to poverty is not being able to meet one's health bills because health is so important to everyone. Having to choose between your health and your livelihood is a decision that no one should be forced to make. We need, not just in India, but around the world, to respond faster, smarter, and more efficiently to these healthcare concerns. We need to work together to achieve common objectives to improve health outcomes, in this case in India, and since we're gathered in Rajasthan, here in Rajasthan. Developed objectives such as ending preventable child and maternal deaths and creating a TB and AIDS-free India can only be achieved through a multi-sectoral approach in which partners, both public and private, work hand in hand with the state and national governments. In a country like India, where the private sector is the first point of contact for more than 60% of the population, it's especially critical to engage, develop, and nurture private sector partnerships. I should also say at this point that more broadly, partnerships is probably the core theme for USAID in terms of our engagement with India in a very different kind of way. I often, again, mention to my colleagues that when I first came to India, I was looking through the antique shop in Delhi and came across the poster for an old Bollywood film that some of you may have seen, Ek Aur Ek Gyara. Ek Aur Ek Gyara has become my theme through my time here in India. You know, it's not 1 + 1 = 2, but 1 + 1 = 11. And actually, the interesting thing is some of these are multiple partnerships. And so sometimes I say, na sirf ek aur ek is 3, 18, lekin ek aur ek shayad 111. But I love that saying, and again, people that have heard me speak it, I pretty much say it everywhere because I think it really captures the fact that we can, when we work together, be more than the sum of our parts. So I like to do that. And certainly from our perspective, by the way, I think of the Government of India and the states. I mean, that right there is ek aur ek, because it's the central government, but it's also the state. And so, you know, again, we have these sort of triple partnerships. But certainly USAID has partnered with the Government of India over many decades to support India's health goals and priorities. India has changed enormously during that time, and certainly our partnership and the way we work together has changed too. But we are supporting work that will help improve access to affordable, quality health care for India's most vulnerable populations. Innovation is at the core of many of our projects because they help to achieve better outcomes in a more efficient manner. I'm going to conclude by briefly highlighting a few of the health activities that USAID is supporting in India at a state and national level. In partnership with the Government of India, USAID established a national resource unit that monitors maternal and child health progress in 184 high-priority districts providing feedback to the different states on how to strengthen and correct the measures underway. USAID also supports the government's Family Planning 2020 goal to reach 40 million additional users, helping to expand contraceptive choices in the public health system. USAID is partnering with the Government of India to roll out the Meta Hospital program, a new initiative to collect feedback from patients visiting public and private health facilities. These facilities will then use this feedback to improve the quality of services that patients receive. USAID supports national and state governments to design and implement a number of public-private sector partnerships in health. One that this is part of actually is in Rajasthan, here in Rajasthan, where we're supporting the PPP model, in this case through the Wish Foundation, which utilizes innovative service delivery approaches and models to improve the quality of primary healthcare services, in this case in 33 public health facilities. And when it comes to HIV/AIDS, I'll be visiting one of these projects this afternoon. We're working closely with the National AIDS Control Organization, NACO, to increase the uptake of HIV/AIDS testing and treatment. Here in Rajasthan, that includes support for the Technical Support Unit to assist civil society and community-based organizations in improving access to HIV prevention, care, and treatment services. And finally, USAID is working to identify, nurture, and scale social and commercial innovations in India that can in turn be transferred to other innovations in the region and globally. And I talk about the globally because I do think our program and our partnership is more than about our two countries. It's about our two countries and the rest of the world. In many cases, these global transfer programs are founded on innovative products, diagnostic tools, and information technology applications that can be used by healthcare providers and frontline workers. Today's summit provides a glimpse of the many innovations making this vision possible, not only in Rajasthan, but across India and indeed throughout the planet. These are just some of the few examples of the work that we're doing to support India, and our support will not end here. We're eager to continue the dialogue about how we can continue to best support India, and in this case, the state of Rajasthan. With this healthcare summit and the wonderful work the state is doing, I believe that Rajasthan is poised to be looked upon as an important destination for healthcare professionals and policymakers from India and worldwide. A place where healthcare experts can learn about novel healthcare innovations and public-private partnerships. And again, maybe conclude with a final quote, because I think it's not enough to be innovative. You got to tell the rest of the world about those innovations with the idea of trying to adopt them. And here the lines that I often evoke is this one, Jungle mein mor nacha kisne dekha. I saw a peacock on the way over this morning actually, and of course you know the saying, who saw the peacock dancing in the jungle? And when I attend these events in India, I get a feeling of such great dynamism across this great country. And so many wonderful things happen. But the notion is, who saw that peacock dancing in the jungle? Jungle mein mor nacha kisne dekha. I think it really is part about what these summits are about, is to be spreading the word and telling people about that peacock dancing in the jungle and how wonderful and beautiful it is. And I would put that in the same case of some of these innovations. So again, I'm grateful to have been invited to participate in this event. I commend the summit on bringing leading voices together and help furthering this dialogue. And again, thank you very much. Dhanyavad.